Do you know what a seizure is and what to do if someone around you is having one? This may be a good video to share with someone that is not familiar with common seizure questions and answers, caring for someone that has epilepsy or seizure disorder. Let's get started. What is a seizure? A sudden, uncontrolled electrical disturbance in the brain that can cause changes in behavior, movements, feelings, or consciousness. What is epilepsy? A neurological disorder characterized by two or more unprovoked seizures. What are the two main types of seizures? Focal, partial, seizures and generalized seizures. What is a focal seizure? A seizure that starts in one specific area of the brain. What is a generalized seizure? A seizure that affects both sides of the brain at once. What is a tonic clonic seizure? A type of generalized seizure that causes stiffening, tonic, and jerking, clonic, of muscles, often with loss of consciousness. Formerly known as grand mals, what most people think of when they hear seizure. What is an absence seizure? A brief lapse in awareness, often mistaken for daydreaming, common in children. What is an aura in relation to seizures? A warning sign or sensory disturbance that may precede a seizure. What is status epilepticus? A prolonged seizure lasting more than 5 minutes or repeated seizures without recovery in between. It's a medical emergency. Can seizures be triggered by specific factors? Yes. Common triggers include stress, lack of sleep, flashing lights, alcohol, and illness. What should you do during a seizure? Protect the person from injury, keep them on their side, and time the seizure. Do not put anything in their mouth. When should you call emergency services for a seizure? If it lasts longer than 5 minutes, if the person has trouble breathing, or if it's their first seizure. What are postictal symptoms? Symptoms after a seizure, such as confusion, fatigue, headache, or memory loss. Can someone be conscious during a seizure? Yes, during focal aware seizures, also known as simple partial seizures. What are common causes of seizures? Epilepsy, head injury, brain infections, stroke, high fever, or low blood sugar. Can seizures be treated? Yes, with medications, surgery, lifestyle changes, or devices like vagus nerve stimulators. What is an EEG? An electroencephalogram, a test that records brain activity and helps diagnose seizures. Are all seizures epilepsy? No, some seizures are provoked by temporary conditions and may not indicate epilepsy. Can seizures be hereditary? Yes, some types of epilepsy have a genetic component. Can lifestyle changes help manage seizures? Yes, consistent sleep, medication adherence, stress management, and avoiding triggers can help. What is a myoclonic seizure? A type of seizure that causes brief, shock-like jerks of a muscle or group of muscles. What is a febrile seizure? A seizure triggered by fever, most commonly in children between 6 months and 5 years old. How do anti-seizure medications work? They stabilize electrical activity in the brain to prevent seizures. Can someone drive if they have seizures? It depends on seizure control and local laws. Often, a seizure-free period is required before driving is allowed. What is SUDEP, sudden unexpected death in epilepsy? A rare but serious risk where a person with epilepsy dies unexpectedly, often during sleep. It says rare but never feels rare for a family of a loved one. Speak with your doctor regarding risk factors. I hope this helps answer some of the common questions and answers regarding seizures and epilepsy.